Today's top stories. Povorcitinib beneficial for HS in Phase 3 studies. Topical finasteride effective for hair loss in men. Allopurinol offers no heart benefit in kidney donors. Pediatric firework injuries more common in teens and boys. NHS, summer surge, keeps corridor care above 3,000. Nearly half of U.S. internal medicine docs are foreign-born. New Rome v. criteria broaden diagnosis of gut-brain disorders. Cardiometabolic index can predict mortality risk in T to D. Updated guidelines refine solitary plasmacytoma diagnosis and Stat+, an investigation into Commure and Medicare's new tech incentives for AI devices. We start with Povorcitinib beneficial for HS in Phase 3 studies. Povorcitinib beneficial for HS in Phase 3 studies. Treatment with Povorcitinib, an oral JAK1 inhibitor, resulted in significant improvements among patients with moderate to severe hidradenitis suppurativa, HS, in 2 Phase 3 trials, providing evidence that the drug may present an alternative to injectable biologics. STOP-HS1 and STOP-HS2 were identically designed, randomized, double-blind, placebo-controlled, multinational trials that included 1227 adults with moderate to severe HS, randomly assigned to once-daily Povorcitinib 45 mg, Povorcitinib 75 mg, or placebo. The results were published in Nature Medicine on July 23. Current FDA-approved treatments for moderate to severe HS are adalimumab, a TNF inhibitor, secukinumab, an interleukin-17A inhibitor, and bimekizumab, an IL-17A IL-17F inhibitor, all of which are administered subcutaneously. Povorcitinib offers a different mechanism of action from direct cytokine inhibition to reduce inflammatory lesion burden in HS, reduce skin pain, and reduce flare frequency. Amit Garg, MD, professor and chair of the Department of Dermatology at the Donald and Barbara Zucker School of Medicine at Hofstra/Northwell in Uniondale, New York, told Medscape Medical News. When available, topical finasteride effective for hair loss in men. Topical topical finasteride 0.25% monotherapy was well tolerated and significantly improved hair density, thickness, and terminal to vellus ratio in men with androgenetic alopecia, AGA, over a period of 52 weeks. Methodology: researchers conducted a retrospective observational study of 123 adult men with AGA, Norwood Hamilton Scale grades 2-5. Mean age: 32.4 years. Treated with topical finasteride 0.25% monotherapy between April 2022 and November 2025. Patients applied either a hydroxypropyl chitosan-based solution using a commercial spray, N equals 78, 2.275 mg/ml, with 1 to 4 sprays daily depending on the affected area size, or a compounded hydroalcoholic lotion containing finasteride 0.25% WW, N equals 45. 1 ml once daily using a graduated dropper. Participants were evaluated at baseline and after 52 weeks using standardized clinical photography and videodermoscopy, VIDIX system, with paired intrapatient comparisons of identical scalp target areas. Main outcomes included the total hair number THN, hair shaft thickness, HSD, and terminal to vellus hair ratio, assessed via trichoscopic evaluation at the vertex and/or frontotemporal regions. Other outcomes were physician G. Allopurinol offers no heart benefit in kidney donors. Topical in healthy living kidney donors, 300 mg of allopurinol daily for 9 months led to a significant reduction in uric acid levels, but had no effect on left ventricular mass, blood pressure, or insulin sensitivity. Adverse events occurred more frequently with allopurinol than with placebo. Methodology: researchers conducted a Phase 2b trial to evaluate whether lowering uric acid levels with 9 months of allopurinol would improve left ventricular mass, blood pressure, or insulin sensitivity in healthy living kidney donors. They included 71 healthy kidney donors with an estimated glomerular filtration rate above 30 ml min 173 m2, examined at least 6 months post-nephrectomy, and randomly assigned them to receive either 300 mg of allopurinol daily or placebo for 9 months. The per-protocol analysis included 53 participants who completed 9 months of treatment. Of these, 26 participants, mean age, 55 years. 61% women received allopurinol and 27, mean age, 55 years. 41% women received placebo. The primary outcome was a change in left ventricular mass from baseline to 9 months, measured using cardiac MRI. Secondary outcomes included changes in ambulatory blood pressure, insulin S. Pediatric firework injuries more common in teens and boys. Topical, a retrospective analysis of U.S. Emergency Department (ED) data found that upper extremity injuries related to fireworks in pediatric patients predominantly affected boys and adolescents, with thermal burns to the hands and fingers accounting for most injuries and nearly 14% of patients requiring hospitalization. Methodology: researchers used data from the National Electronic Injury Surveillance System, NEISS, which compiles information on injuries from approximately 100 EDs across the United States. The analysis included all cases of firework-related upper extremity injuries reported between 2015 and 2024 among patients younger than 18 years. The primary outcomes included injury occurrence, demographic trends, anatomic injury patterns, diagnostic categories, ED disposition, and annual injury trends. Takeaway: a total of 434 pediatric cases, national estimate equals 16,872, of firework-related upper extremity injuries were reported between 2015 and 2024. Injuries were more common among boys than among girls, 77.9% versus 22.1%, p.001, and among patients aged 12-14 years, 23.3%, or 15-17 years, 25.1%. Injuries to the hands and fingers accounted for 48.8% and 32.7% of all NHS summer surge keeps corridor care above 3,000. The number of patients in England being cared for in hospital corridors or makeshift areas has remained above 3,000 a day for the second month in a row, as the NHS experiences a summer surge. Health officials said there has been a record 2.5 million A&E attendances last month amid 2 heat waves. Health Secretary Yvette Cooper warned the health service must start planning for summer pressures in the same way as winter. However, the data shows overall waiting times for treatment fell slightly in June after rising for 2 months in a row. An average of 2,300 patients received corridor care in A&E departments in England each day in July, along with 728 patients elsewhere in hospital wards, totaling 3,028. This is down slightly from an average of 2,439 patients in A&E departments and 749 in hospital wards each day in June, totaling 3,188. It is the third time corridor care figures have been published by NHS England, and the second consecutive month they have remained above 3,000 a day. The data covers patients who have been receiving corridor care for at least 45 minutes. This means care did not take place in a clinically appropriate and safe setting where patients have privacy, access to. Nearly half of U.S. internal medicine docs are foreign-born. As the Trump administration continues to support a crackdown on legal immigration, a new study reported that physicians born in other countries account for nearly half of a sample of almost all internal medicine physicians in the U.S. These physicians are more likely than native-born colleagues to care for patients who are poor, disabled, Black or Latino, or living in medically underserved communities. Economist Giacomo May, Ph.D. of the American Board of Internal Medicine, and colleagues reported on August 12 in JAMA. In 2026, non-U.S.-born international medical graduates, IMGs, made up 36.1% of 249,679 internal medicine physicians who were board-certified from 1990 to 2025, and non-U.S.-born U.S. medical graduates, USMGs, accounted for another 11.1%, the study found. IMGs graduated from medical school outside the U.S. and Canada, whereas USMGs graduated from medical schools inside the U.S. Some clinicians may not realize just how dependent internal medicine is on non-U.S.-born IMGs, May said. IMGs are most concentrated in specialties that have difficulty recruiting physicians and disproportionately treat patients who have greater difficulties accessing care. White House policies dis. New Rome v. criteria broaden diagnosis of gut-brain disorders. 10 years after Rome IV, the Rome Foundation published Rome V, updating the International Diagnostic Criteria for Disorders of Gut-Brain Interaction, DGBIs. The new criteria are intended to better reflect patients seen in routine clinical practice. The update also introduces several new diagnostic entities and refines existing criteria without fundamentally changing the management of DGBIs. It also confirms the move away from the term functional gastrointestinal disorders, replacing it with terminology that better reflects the current understanding of these conditions. Diagnostic criteria to better reflect the range of clinical presentations. Rome V introduced clinical criteria intended for use in routine practice. A diagnosis can be made when patients have the following: symptoms consistent with DGBI, an organic disorder that has been reasonably excluded, symptoms that are sufficiently bothersome to prompt consultation or interfere with daily activities in irritable bowel syndrome, IBS. Abdominal discomfort is reintroduced alongside abdominal pain because some patients primarily describe discomfort rather than pain. The frequency threshold has also been relaxed. Abdominal. Cardiometabolic index can predict mortality risk in T2D TOPLINE, a U.S. cohort study involving patients with type 2 diabetes, T2D, found that a higher cardiometabolic index, CMI, a composite marker of central adiposity, waist-to-height ratio, and lipid metabolism, triglyceride to high-density lipoprotein cholesterol ratio, was independently and linearly associated with an increased risk for all-cause and cardiovascular mortality. Methodology: previous studies had shown an association between CMI and metabolic syndrome, metabolic dysfunction-associated fatty liver disease, hypertension, arteriosclerosis, and higher all-cause mortality in older adults. But the prognostic value of CMI for all-cause and cardiovascular mortality in comparatively younger patients with T2D remained unclear. Researchers conducted a prospective cohort study to examine the association between CMI and long-term all-cause and cardiovascular mortality in patients with T2D. They analyzed the data of 2188 patients, mean age, 51.1 years, 47% women, with T2D from National Health and Nutrition Examination Survey, 1999-2018. Based on the optimal cutoff for survival association of 1.84, they stratified participants into higher CMI, CMI 1.84, N equals 366, and lower CMI. Updated guidelines refine solitary plasmacytoma diagnosis. Solitary plasmacytomas, SB, are rare, localized tumors composed of clonal plasma cells. They occur either in the bone or soft tissue and must be distinguished from multiple myeloma, which requires systemic treatment. Approximately 50% of patients with solitary bone plasmacytoma progress to multiple myeloma within 5 years of definitive local radiation therapy, compared with approximately 30% of those with solitary extramedullary plasmacytoma. The International Myeloma Working Group recently published a comprehensive update to the recommendations for the diagnosis and management of SB. The consensus highlighted advances in imaging and laboratory testing that can more accurately determine whether the disease is truly localized or whether additional lesions or bone marrow involvement suggest systemic disease. Advanced imaging: historically, diagnosis has relied on conventional X-rays, which lack sufficient sensitivity to detect additional lesions. These updated recommendations call for advanced functional imaging, such as PET or whole-body MRI, to identify otherwise undetected lesions. Finding additional diseases can change the diagnosis from SB to multiple myeloma and alter the treatment. STAT Plus, an investigation into Commure and Medicare's new tech incentives for AI devices. Katie covers the impact of health technology on patients, clinicians, and businesses. Her stories explore the price tag of clinical AI, digital health at the FDA, and the boom in direct-to-consumer telehealth. Confidential tips can be sent on Signal at Palmer 01. You're reading the web edition of Stat's Health Tech Newsletter, our guide to how technology is transforming the life sciences. Sign up to get it delivered in your inbox every Tuesday and Thursday. Hello, health tech readers. Next week, the newsletter is going on its annual summer hiatus. We'll see you back on the 25th. Advertisement today, a deep dive into Commure, a company promising to automate the business of health care with artificial intelligence, and all the levers it's pulling to make that happen. Let's get right into it. Katie covers the impact of health technology on patients, clinicians, and businesses. Her stories explore the price tag of clinical AI, digital health at the FDA, and the boom in direct-to-consumer telehealth. Confidential tips can be sent on Signal at Palmer 01. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.